my surgery, I had a femoral malrotation repair caused by a car accident 20 years ago. I first learned about ActiveCare because they were right outside of my door of my room, and I could see a gentleman named Joe dealing with all of this equipment, and I saw him putting it together and testing it and bringing it back and forth, not realizing that it would have anything to do with me, because Dr. Herzenberg had not been using that previously, was my understanding. And it wasn't until Joe came into my room and presented me with this that I knew what it was. Joe is one of the sales reps. Really, really nice guy who I've seen frequently in the hospital, was very engaging, very kind, talked me through it, talked my husband through it, so we knew exactly what we were supposed to do, what the expectations were, what the benefit was, and how, if we had any issues, who to contact. It's certainly a better alternative than shots in your belly or another high-powered blood thinner that is unnecessary. I'm not sure why the doctor chose to go with ActiveCare. I know one of his affiliate doctors, or one of the doctors that he works with, uses this and has been very successful with it. My understanding is that I was one of his first patients to use it, only because the nurses said, Dr. Herzenberg never uses this. But it was wildly successful for me. I didn't have any issues. I believe they put the ActiveCare on the second day, and it was seamless. I mean, it fit so nicely around my leg. There weren't any gaps. It didn't shuffle up and down. If I got up, it got up with me. I didn't realize that it was sitting on my leg at all. I liked ActiveCare because it was really easy. I mean, I didn't even notice that it was on. I could wear my pants and nobody could hear it, nobody could see it, nobody had any reason to think that I was any different than anybody else, which was nice to feel just kind of like everybody else at the time. But I especially liked it because I didn't want to take any blood thinners. I didn't want to have to be further dependent on medication at the time, and it allowed me a little bit more freedom and a little bit more control of my own care. I used ActiveCare for 6 weeks, in and out of bed, going to appointments, going to physical therapy, all the time. Yeah, it was, the ActiveCare in some ways became a part of my leg because I wasn't even aware it was on. It was very, very quiet. It wasn't disturbing. It wasn't in my way. It could fit right under my pants. I really didn't see any complications from it. I recharged the ActiveCare device maybe once a day, but if I was sitting down next to an outlet, I would just plug in. So it wasn't, and I was fairly immobile immediately after my surgery, so it wasn't a big deal to have it charging. But even when I would go to physical therapy away and I would be gone for 3 hours, it was very easy. It never beeped on me. I think one time I was gone for 6 hours, and even though they said the life was 6 hours, it lasted longer than that. ActiveCare was easy to sleep with because it was quiet. It didn't disturb me. It's very soft pressure around your legs, so it didn't wake me up. I was released from the hospital on December 22nd. Yes, I was released from the hospital on December 22nd with the ActiveCare device, and it was the easiest device that I was released from. I had many other things that had to go home with me, but that one was the easiest. It just went right around my shoulder, went into the car with me, and came home with me. It was easy. The doctor told me I did not have to continue with the aspirin once I got home because of the ActiveCare. ActiveCare was just as easy at home as it was in the hospital, and my husband never heard the machine either. I mean, we both were able to sleep comfortably and manage, our at-home routine with me wearing the device without any issues. ActiveCare didn't limit me at all. I was able to move around my house normally. I was able to go up and down the stairs as much as my body would allow me to do stuff. I was able to do it without any kind of issue. Every day I used it all day long, except for when I would take a shower. So on average, I used ActiveCare about 23 hours a day. ActiveCare was very comfortable. It just became part. ActiveCare was almost like a second skin because it was so seamless. I mean, I did not notice any difference between that and just my regular leg. The ActiveCare service was fantastic. They brought it to me in the hospital. I wore it at home. Returning it was easy. The representative was actually there when I came back from my evaluation with my doctor, and I ran into him. And he remembered who I was and asked me if there was anything I needed, how it had gone, if I'd developed any DVTs. And it was just excellent care.